Hi, Andrew Pieri, breast surgeon. So we're going to talk a little bit about different factors to think about when you're choosing breast implants. Most people focus mainly on breast implant volume, but there's a lot of other things to think about when choosing which implant is right for you and your body. We measure implant volumes in cubic centimetres or cc's, which is exactly the same as mils, millilitres. So this is a 300cc implant, which if you poured 300 mils of water into a jug, it would be exactly the same volume as this, essentially. The best way to get an idea about which implant volume you want to go with is to use an implant sizing kit in clinic. You can use different sized implant inserts which go into the bra and allow you to visualize exactly what it would look like to have that volume of implant. This usually gives the surgeon a range of volumes that you feel would be appropriate for you. So, for example, the upper limit being around 330 cc's and a lower limit of 270 cc's. So there's a little bit of wiggle room there to then adapt the other factors of the implant around and get what's right for you. Implant surfaces range from being very textured like this implant through to being completely smooth. There's two main advantages to a more textured surface. Firstly, implants with more texture, there's some evidence to suggest that they cause less capsular contracture, or it takes longer for capsular contracture to occur. Secondly, the kind of more grippy texture means that it's less likely to rotate inside the pocket because it can grip the tissue slightly better, almost like a Velcro texture. Rotation is more of a problem obviously with anatomical or teardrop shaped implants like this. So if that was to rotate upside down, obviously that's a big problem. With a round implant, it doesn't matter what position that sits in from a rotational point of view because it's the same all the way around. The grippy surface also helps to counteract gravity. So when that implant's sitting in the pocket there, gravity is pushing the implant down, and you can get a complication called bottoming out, where the implant manages to drop below where the bottom of the breast should be. So this extra surface texture helps prevent that as well. Now, the main downside to having heavily textured implants is a really big problem. ALCL stands for anaplastic large cell lymphoma, and it's a type of cancer that's caused by breast implants. It's thankfully rare, currently with a risk of around 1 in 25,000. But it is certainly highly associated with the implants that have this very rough texturing on the surface. Certainly I feel that this risk due to ALCL heavily outweighs the benefits of heavy textured implants, and therefore I wouldn't recommend them anymore. Some more modern textured implants are kind of microscopically textured, and they're termed nano-textured surfaces. These are potentially the best of both worlds and as I say, the evidence isn't strong enough yet because there's not enough cases, but they may be associated with less ALCL or no ALCL and might also offer some benefits in terms of reduced capsular contracture and reduced bottoming out compared to smooth implants. This is a round implant where you can see it is a dome shape and symmetrical all around it. This is a teardrop or anatomical implant where you can see that the top part is thinner than the bottom part, so most of the volume is concentrated in the lower pole of the implant, which a lot of people describe to be a more natural kind of look. The main downside to a teardrop shaped implant is that if it rotates, so it would be in like this, if it rotated, obviously that's a cosmetic disaster and you'd need a reoperation to fix that. Now this is countered to a large degree by the rough texturing, which makes this implant more grippy. But if you watch the last video, you'll see that we're moving away from this rougher texture to smoother textured implants, and this becomes more of a risk nowadays with modern implants. If a round implant is used, obviously rotation is not a factor because whichever way it rotates within the pocket, it's symmetrical, so it doesn't make any difference. Now, with some of the modern round implants, what we're finding, depending on the gel fill, is that really when you hold them up vertically, most of the volume drops into the bottom part of the implant anyway, which mimics an anatomical shape. So really the downside or the factor that people talk about when they talk about the anatomical implants appearing more natural, I feel with modern round implants, it's not necessarily such a big factor. So I tend to use round implants predominantly because I think they do give a natural appearance, and you don't need them to be heavily textured to try and prevent rotation. So looking at dimensions, both of these implants are 120 cc's, so they're identical in terms of volume. I don't know if you can see from there particularly though, they're very different in terms of their width. So this implant is a lot wider than this implant. And to make up for the difference, this implant is then much more projected than this implant. And so it has a higher profile. Now, obviously you get a very different look from both of these implants, even though on paper they're both 320cc implants. This implant's going to give a much more projected look with a kind of full cleavage, particularly in somebody with a narrower chest, or what we call base plate of the breast. Whereas this implant's going to give a slightly more natural appearance where the volume is spread out across the breast a little bit more with less nipple projection.